Welcome to another episode of Let's Talk Small Data with T, where we are passionate about the power of small data in healthcare. I am your host, Tanazia Gonzalez, but you can call me T. Data has certainly changed the game in healthcare. Big data has blown the roof off, but small data, now that's the future. Small data allows us to dive deep into the key insights and take quick, customized action to achieve phenomenal results in performance and quality improvement. Let's explore this today. Thanks so much for joining us. If you have any questions for me or any of my guests, feel free to reach out to me at tgonzalez@eima-inc.com. Enjoy the show. Let's go. Welcome to another episode of Let's Talk Small Data with T, where we explore the power of small data in healthcare. I'm so excited to have Sujata Gidumal, I hope I pronounced that correctly, on the show today to talk about price transparency. She is super passionate about price transparency and really helping patients and informing patients and empowering patients to make better decisions. And that is what we're going to be talking about today. We're talking about what the folks over at ClearCost Health, where Suji, we call her, serves as a vice president. They're doing some great things to help patients make better and informed decisions. And Suji, welcome to the show. I'm going to go ahead and ask you to start your video, and we can start our discussion.
Perfect. Thank you so much for having me.
Thank you so much for being on the show. We've been talking for some time about getting together and talking about price transparency and some of the stuff, the things that you all are doing at ClearCost. First of all, what do we mean by price transparency? Exactly what is meant by that?
Great question. And yeah, I appreciate you having me on. I'm excited to talk about this with you today. So when we say price transparency, what we're talking about is giving people, empowering patients with the ability to see how much it is that they're going to pay for their healthcare before they go to see a healthcare provider. So whether it's a doctor or a therapist or anything like that. When I say provider, I just mean generally anyone who is working in healthcare. So it's allowing for transparency in pricing so that when you're going to go to a provider, whether it's for physical therapy or an MRI or just to visit your doctor for a checkup, you have an understanding of what the cost may be when you go there, so that you can make an informed decision.
Cool. And like a lot of folks really don't understand that there could be a significant cost coming out of their own pocket. Right.
Yeah,
So,
I think that for years, people had copays with their plans, or a small amount of cost share when it is that they go to the doctor, and so people just kind of got used to paying $10 or $20 when you go to the doctor and not really thinking about cost or looking at different options. I think that more and more people are very much becoming aware of the fact that healthcare comes with a pretty significant cost, and I think that's something that people are actually very cognizant of these days, just because there's been such a trend. As I said, it used to be that health plans would have a copay when you went to see a provider, whether it was for imaging like an X-ray or an MRI, or going to the doctor or getting your lab work done. And now it's really moving towards more of a deductible type of plan, where there's a certain amount that you need to pay when you go see a provider or receive healthcare services before the health plan starts to kick in with any services or any payment at all. And so, there's a deductible, which may be as little as $250 or $500. There might be as much as $5,000 before the health plan, the health insurance company, starts to contribute. So all of a sudden, if people are in what they call a high deductible health plan, which would really be a deductible anywhere from $2,000 to $5,000, I would say. All of a sudden people have to be really cognizant of how much it is that they're spending, because you're exposed to the price of the care. You're going to be paying for that for a long time before your health plan starts to kick in any of that cost. The other thing that actually one of our we have two co-founders, both who have been in healthcare and healthcare reimbursement for a very, very long time, longer than I'm actually allowed to say. They're both older. So many decades. And the way that they like to frame it is, by putting people in a high deductible plan, you are making them have skin in the game, but
Mm.
they don't have any way to save their own skin. So it's like, hey, you're in this high deductible plan, but we're not going to tell you how much you need to pay. It's like if you went to a restaurant and they said, you're going to be paying for this meal. You can choose what you want to order from the menu, but there's no prices on the menu. And we'll tell you in a few weeks how much it is that you spent, and then you'll need to pay it.
Right.
So, it's
Usually when you
crazy.
walk, usually when you walk into a restaurant or any store and there are no prices listed, it means get out,
Yeah, it
because
means very expensive.
very expensive. That's what it
Yeah,
means. Like,
yeah. This is for
remove
people who don't
yourself
care. Yeah.
immediately. Right.
But if
So
you think about it, that's
yeah,
how all of healthcare works. So,
yeah.
all of healthcare is you're going to come here. You don't know exactly what services you're going to get. You don't know how much it's going to cost. You don't know when you're going to receive a bill. It's just very opaque. And so, what we're
Mhm.
trying to do is to make it a little bit more transparent so that you
Right.
can navigate and be in charge of your own care.
That's kind of considered part of health literacy. Yeah. I mean, like
Yes, definitely.
understanding, you know, what's the totality of what you're responsible for, what you need to do, what you have to do, and
Absolutely. And
what.
it's also, I
Mhm.
would say it's a tool to help people towards health literacy, right? So
Okay.
it's
Yes.
it's a tool that people can use
Mhm.
to become more informed.
Right. Because it could be a little intimidating to
Oh
folks,
yeah.
especially folks who are not, you know, interacting with folks or that computer savvy. They may think, oh no, that's too complicated, I don't, or whatever, and then wind up with huge bills. And I don't know how this happened, so ClearCost Health, what exactly does ClearCost Health do?
Sure.
And
So what we do is we take claims data, which is data on, what patients received which services and how much was paid.
mhm,
And then we reverse engineer that own data. So it's kind of like a train that makes its own tracks, essentially.
okay,
And we turn that into a tool that's really easy for people to use. So
okay,
we have a website and a mobile app, and you can log on, type in whatever it is that you're looking for, the
mhm,
service that you want to receive. So knee MRI, delivery, like if you're about to have a baby and you want to know how much that's going to cost, that's something
mhm,
that people definitely like to have an estimate of before
mhm,
it is that they go into the hospital.
mhm,
Doctor's office visit, whatever it is, you can type
mhm.
in what it is that you're looking for, and we'll show you the providers that are in your area,
Okay,
that are in network within your plan. We'll show you the total cost, which is the amount that was negotiated between the health plan and the provider in terms of
okay,
what will be paid. And then we'll show you the patients, meaning your out of pocket
mhm,
cost, estimated out of pocket cost. And
mhm,
that depends on your benefit plan. So,
okay,
are you on a deductible? Do you have a copay? We take all of that into consideration, as
right,
well as where you are in your plan. So,
okay,
if it's January and you have a deductible, you may not have spent anything towards your deductible.
mhm,
And so you might be responsible for the full cost. If it's December and you've already
mhm,
spent your deductible, you may be in the co-insurance part of your plan. You might have hit your out-of-pocket
okay.
maximum and not have to pay anything. And so we do a real-time ping and then take all of that into consideration when we give you your cost estimate.
Nice. So in the system, or is it very visual, or
Yeah.
is it a bunch of tables, or folks have an option like how they want to view it?
Yeah.
'Cause-
Yeah. You can view it in a table, in a map.
nice.
You can sort, filter, all of those fun things that that I feel like they're things that people have now come to expect from websites, essentially.
Okay.
It's kind
Yeah.
of
I
like
mean,
shopping. It's like shopping for your healthcare. So almost the same way
totally.
that you would shop online, you're essentially
Hmm.
just shopping
Hmm.
for your healthcare.
Right. True empowerment, right? And like if I'm
Yeah.
a regular customer, I want to go to the site and I'm going, okay, I don't really understand this. I don't get it. Is there someone I could pick up the phone and call and have them walk me
Absolutely.
through what I'm looking at?
Yeah, so we offer the service directly to large employers,
Okay.
and then they offer it to their employees as a benefit. And in
Okay.
that instance, we provide the call center, which we actually call our health shoppers. So,
Okay.
as I just said, you're shopping for health insurance. That's why we call
Right.
them health shoppers.
Okay.
And they provide personalized service on the phone. They'll provide reporting. They'll provide, additional things that you might need in order to help you get a certain service at a certain place.
Right.
We also offer this tool as just a database and a tool to other other entities within healthcare. So for instance, health plans might use us on the back end,
Okay.
and then feed that into their website. There might be a TPA which works with the health plan, and they might be using us to feed into their website. There's other kind of larger companies within the healthcare realm
Yeah.
that are using us on the back end, and then we power their call center and things like that. So we do a lot of that
Okay.
stuff as well.
Yeah.
But to the point of small data, when it comes to the call center representatives and the types of tools that they have, when we're talking about taking all the claims data and turning that into pricing, that's really on a more macro level. When you're talking about that, you're talking about huge claims data sets, you're talking about algorithms and
Right.
turning that into pricing. When we talk about small data, we're really talking about, T wants to go get an x-ray of her knee.
Right.
That is at the individual level. Or
Mm-hmm.
T needs to go get lab work done.
Mm-hmm.
Where does she go and how does she do that? So
Mm-hmm.
how do we help you start to make smarter decisions, understand what those decisions are, understand what your plan means, understand what your costs may be,
Right.
and then also understand, like, okay, I went on this website, I searched, I understand that if I go to the hospital, which I've been going to for years, they're actually going to be charging me hundreds of dollars for this lab work. If
Mm-hmm.
I went to Quest or LabCorp, they would only charge me about $50 or $60 for the exact same lab work.
Mm-hmm.
So how does T then understand, okay, I'm going to change from this hospital to Quest and LabCorp? What are the little things that need to be done in order to make that happen? And I think that's where, it comes to, what is the data that we can provide? What is the support that we can provide in order to help someone make that decision? And that all of those small decisions then lead to larger change.
Do you all also take into consideration or present quality or
Yes.
reviews?
Yeah, that's a
Like,
great question.
yeah.
Yeah, we work very closely with Healthgrades, which is the
Okay.
largest provider of quality data in the United States.
Yep.
Typically, when you Google your doctor, Healthgrades will be the first, or if not the first, one of the first options that shows up on Google. And it's
Yeah, it's
something
the
that
first
people
place I go. Yeah.
exactly, it's a place
Mm-hmm.
that people trust a lot, and it has a lot of quality data. We pull in other, healthcare quality metrics for hospital safety, leapfrog, things like that. We also
Okay.
work with all of the different health insurance companies because they all also have their own
Yeah.
quality metrics. And so, Aetna has the Excel network, Cigna has a different network, Blue Cross Blue Shield has a different network. So we pull in all of those depending on the plan that you're on.
Nice.
Yeah.
That's I was just speaking to a gentleman in Nairobi, Kenya, about something he calls a healthcare recommender. And it's kind
Okay.
of like it uses a Netflix type of algorithm in the background to present options, best options for patients based on other metrics and data
That's
that they're
great.
pulling on the patient, saying, okay, we see you may have this issue. Here is what we're recommending for you to have the best outcome.
Yeah.
And so, like me as a patient, I could take that and go, okay, this is what Health Recommender is recommending. Let me go to
Yeah.
ClearCost and see what's the best financial road I need to take in order not to have to take out a second mortgage on my
It's
house.
interesting. Yeah, it's interesting you say that because so these employers that we work with, they're massive employers, like Fortune
Yes,
500 type companies.
right,
And what they'll do is they'll pair us a lot of the
right,
times along with other services. So whether it's second opinion, whether it's
mm,
quality or something like that, and
right,
then have kind of a concierge or an aggregator or someone to help
mhm,
the patient in the center to say,
right,
okay, we feel that you may need knee surgery, but you might want a second opinion on that. And then you might want to go to make sure that you go to a place that it has a good hospital quality rating
mhm,
so that you don't need to have a repeat knee surgery. But then
mhm,
we'll also want to take that additional consideration of the finances into consideration and then pile all of that together and then
mhm.
end up with the perfect place for you, basically.
Okay. Do you all have a sense of how many individuals actually use the service out of the total that's offered
Yeah,
service? Like
it's a
what's
great, yeah, it's a great question. I think
Mhm.
it very much varies depending on the employer and the situation in which it's being offered. A
Okay.
lot of the times what employers will do is that they will offer incentives
Mhm.
initially to use the service, just to help people become aware of it and
Right.
help people, help people understand that it even exists. And we've had employers in the past that have done things like your healthcare premium, your monthly premium that you're paying towards your plan
Mhm.
is more expensive if you're not using ClearCost, because what they're assuming is if you're using ClearCost, you're naturally going to be steering yourself to less expensive providers.
Right.
If you're not using ClearCost, then you're not really taking, there's no way you're going to be taking costs into consideration. And
Right.
so it's almost similar to if you've seen like narrow network plans where they
Mhm.
limit the providers that are in the network to try
Uh-huh.
and control the costs.
Right.
ClearCost almost helps people create their own version of a narrow network plan, and based off
Okay.
of what their priorities are. I think one of the things that you and I have talked about in the
Mhm.
past is, you might be going to like someone who has diabetes, for instance, might
Mhm.
go to an endocrinologist very regularly. They
Mhm.
might get blood work done very regularly, and maybe
Mhm.
there's some imaging studies, whether it's like, a thyroid ultrasound or sonogram that they need to
Right.
check in on every year, a mammogram maybe yearly, depending on your history, whatever it is. So
Mhm.
there's certain services that they're getting every year.
Yeah, the
If
eyes.
someone's
Yeah.
Exactly, if
Mhm.
someone's endocrinologist is expensive, they
Mhm.
might say, you know what, I'm comfortable with the fact that my endocrinologist is expensive because they are phenomenal. I've known them for a very long time. They understand my history, and I'm
Right.
not comfortable changing the provider. I'm comfortable spending a little bit more money. But, you don't know the person who's going to be reading your lab work, and you don't know the person who's going to be doing your
Right.
mammogram necessarily. So there's a lot of providers out there who you could look into and maybe
Mhm.
start to decrease your costs in that way. And that
Right.
way you're not funneled into a narrow network plan with no choice over the providers. Instead, it's
Right.
saying, okay, these are the various choices that you have to try and help you control the cost of your care. Maybe
Right.
keep your endocrinologist, but make an informed decision. And if you want to switch where you're getting your lab or your imaging done, that might make sense for you to
Right.
help you control the cost of your care.
Totally. No, I get that. And I know like with certain populations like the diabetics, there's a whole journey of
Yes.
costs
Yes.
that can be discovered there. And I could
And
totally
can
see.
be very overwhelming.
Oh, yes, yes, yes. And like you were saying with the relationships that people have formed with the endocrinologist or, their PCPs, the doctors too have their own relationships going on in the background that are hard to break as well. So I like that you're putting the information with the patient and having, the patient be the one saying, listen, doc, can
Yeah.
we change what's happening here and here because it's resulting in high costs for me?
Yeah,
Um,
and the other thing is, it's again going back to that shopping example. You might say,
mhm,
I love these cookies and I can only get these cookies from Whole Foods.
right,
So I'm going to get these cookies from Whole Foods. Everything else I'm going to get from Costco. I don't care.
right,
But my favorite cookies, they don't sell them at Costco, and I'm going to actively make a choice and spend a little bit
right,
more and go to Whole Foods for these cookies. But you made that choice.
right,
You knew what the cost was in the two different places. You
mhm,
knew the quality, and you
mhm,
decided that I'm going to shop at Costco for everything, but I'm getting these cookies from Whole Foods. It's the
right,
same thing in healthcare, right? You shouldn't be getting your lab work from an expensive place just because you don't know that it could be cheaper somewhere else. You
right,
should be saying, I'm going to go to my endocrinologist. He's a little bit more expensive, but I love him. And I'm going to stick with my endocrinologist,
yeah,
but I'm going to get my labs and imaging at the Costco of, healthcare, whatever it is.
yeah,
So, but when you go to Costco, you make that choice. When you go to Whole Foods, you make that choice, and you know
right.
what choice you're making. So in healthcare, it should be the same thing.
It's informed and you're aware. So, I mean, it never hurts to just be aware, put everything on the table, and then you can make the decision. So I love
Absolutely.
that. So I love what you guys are doing with the what was it called? The health shopper.
Yeah,
That's awesome. Are there any success stories that you can share, like of a patient
absolutely. Yeah,
with the health
absolutely.
shopper service? Yeah.
There's a lot, and there's success stories kind of on a variety of different angles. So one that I think illustrates the power of small data really well
Mhm.
is, we were working with a very large employer that had employees in something like 15 states or something like
Okay.
that, and we were helping them analyze their pricing data at a macro level. And then we started to drill in and get smaller and smaller and smaller, and we found that there was this one geographic location around one specific city where they had a headquarters, where the cost of certain services like x-rays and MRIs and things like that, which we call imaging services, was proportionately much more expensive
Okay.
than anywhere else. So we were drilling down and drilling down and drilling down. And so what we did is we worked with them to kind of drill into the market, understand, okay, most people are going to this hospital. This hospital has negotiated really high rates for these services. And most people probably don't even know that there are other places where they could go, because the hospital probably has plastered advertisements on everything. And so everyone's thinking of that hospital, and no one knows that, you know, ABC imaging is around the corner and they're actually really high quality. And a lot of the times, actually, those freestanding imaging centers, they have the same exact machine that the hospital is using, and the same radiologist is reading the image in both places, because they've outsourced to a third-party group of radiologists, and the
Right.
radiologists read the images for the hospital and they read the images for the imaging center. So it's not
Right.
even like you're getting any different quality. Anyway, we drilled into the market. We found the hospital that was driving, or a few hospitals that were driving a lot of the costs. And then we literally made phone calls. Our health shopper team made phone calls in the market
Oh,
to
wow.
imaging centers, made sure that we had their prices correct, made sure we had their locations correct, their
Right.
hours of operation, you know, how do you book an appointment, all of that. And then
Yeah.
we sent postcards to all of the employees who worked at that location and said,
Okay.
did you know that, you know, the cost, if you're getting a knee x-ray, we chose like five common examples. Did you
Yeah.
know that if you're getting a knee x-ray or a mammogram or whatever it is, at this hospital, it's on average costs, you know, $2,500. And at ABC Imaging, it costs $500. Here are, you know, 5 freestanding imaging locations in your area. Here's their phone number. Here's their address. Here's their website. This is how you make an appointment. Like, keep this on your
Yeah.
fridge. And
Yeah.
next time you need to get an imaging service, you know, think
Here it
about
is.
that.
Right.
Yeah, and these people who we were reaching out to, they all were on high deductible plans. And so I think their plan had like a $2,000 deductible, and commensurate, like compared to their salary, that was an extremely high deductible for them.
Right.
To, you know, if you go to a place that's charging you $2,500, when you have a $2,000 deductible, immediately you're paying $2,000 of that.
Okay.
If
Yeah.
you're only paying $500 or even less than that,
Yeah.
you know, that makes a huge difference
Big
to
difference.
someone's,
Big difference. Right.
and so it's taking that macro data and then skinning it down to a group of people, to a population, to, you know, targeted information, and
Right.
then helping them understand and
Right.
make that choice. Like, if you want to go to the hospital for your MRI, you should do that, but you should
Right.
understand what you're doing.
Now that's totally the power of small data. Drilling down and then taking specific action to make improvements. And that's
Yeah.
totally making a significant difference in the lives of the people that have to get those services, because they can save money that can be placed somewhere else rather than,
Absolutely.
yeah. So,
And
uh,
if you send out, like, if I send out a generic email to everyone who works for the employer and
right,
say, hey, FYI, you have ClearCost, and like next time you need to receive services, why don't you use us?
right,
That is fine. And
right.
maybe, you know, it creates some awareness among some people. If
Uh-huh.
I send out a targeted message about a specific group of services
Hmm.
in your area
Hmm.
with places you could go instead,
Hmm.
the impact that that has on a small data level is much more significant than maybe
Totally.
that generic message went to 30,000 people and this
Hmm.
message only went to 3,000 people,
Hmm.
but those 3,000 people are much more likely to take action
Yes.
than the 30,000 people who got the generic message.
Totally. And you know what I found works really well too, if you have someone who could serve as an ambassador, coming from the employee population saying, hey guys, you know, I'm John Smith or whatever, and I've signed up with ClearCost, and here's how I used it. Here's how much it saved me. It was pretty
Yeah.
easy to use, you know, and I don't, you know, I know some of these employers are huge, and you can't really say, you know, here's my phone number, reach out to me if you have any questions. But definitely saying, hey, a peer, you know, I'm just like you know, even if you have a diabetic population and have a representative or an ambassador from that population saying, hey, I represent you. Basically, I have these costs, and I was able to save myself X amount of money by doing this with ClearCost.
Absolutely.
It's so powerful.
Yeah.
Um,
And there's, this specific employer that I'm talking about, they actually installed nurses at
okay.
every location. Every single one of their locations across
Mhm.
the United States had a dedicated nurse, and the nurse essentially was an
Mhm.
employee because they worked for a different organization, but
Right.
they worked at the location. And so they had lunch with
Mhm.
everyone and they knew everyone and they met with everyone every
Yeah.
year. And so
Okay.
people knew them very well, and they were, they did serve that advocacy role in the
Okay.
population. And we would feed them information to
Yeah.
say, hey, this person has potential savings in
Hmm.
terms of services that they've received and where they could have
Okay.
saved money. So
Okay.
we weren't putting it on the nurses to have that conversation just because it's a totally different thing aside from what they were doing. But
Yes.
we did feed them the information so that if they were sitting down and meeting with someone, they would get a flag saying, hey, this person could save money. And so then
Okay.
they would say, hey, I think that ClearCost could really work for you
Right.
because, I think that you might have some areas where you could potentially save money, and it might be helpful for you and your
Right.
financial health to have that. And so here's their phone number. Why don't you give them a call after this meeting?
Interesting. Is there, it sounds like there's like intelligence also built into the system for predictive analytics saying, hey, we've noticed that you've gotten XYZ. It looks like within 2 years, you are going to need this, 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 and you potentially could be spending this amount of money. Does the system
So
also do that?
yeah, it's an
Or
interesting question. The system absolutely can do
AI?
that. People
Yeah.
get very freaked out by it, which I totally understand.
Yeah.
No one likes to know, if I tell someone, hey, the likelihood that you blow out your knee in the next 2 years is 90%,
Ah,
and then they do it, people
do
get a
do
little
do
bit.
do. Yeah. Yeah.
Exactly. So, which I totally
Ooh.
understand. So
Yeah.
we absolutely focus on prior services received as opposed
Right.
to predictive services. So,
Right.
but
Right.
the thing that's interesting about that, and I think I've told you this example already, but for the audience, our health shoppers were working with an individual who was a man in his 50s,
Hmm.
and we saw that he had received a knee MRI followed by knee surgery. And so
Yeah.
we sent him a report that said, hey, FYI, you spent this much on your MRI. And if you had gone to any of these places in your area, you would have
Uh-huh.
spent a lot less. And so maybe that's something to consider for next time. And
Right.
he actually was a little annoyed about it when we first sent it because he felt like, why didn't you tell me this before I got the MRI? And I wish I had known. And this is useless information. He then called us almost exactly 1 year later, and he said, I needed to get an MRI followed
Oh,
by surgery on my other knee. And I pulled up the report that you sent me and I checked it, and that's where I ended up going. I'm really happy I had that because I've spent way less money this year than I did last year.
mhm.
And my coworker went through the same thing. And so I gave him the information and he did the same thing. So,
Beautiful.
it's also a matter of just having people having that awareness. And so
Yeah.
when someone is in the middle of a healthcare event,
Hmm.
they will take the time to look this up ahead of time.
Right. And so now he had such a great experience. He's going to share the love and tell
Exactly.
his connections, hey, check this out. Save me so much money. You might want to consider it. So, word of mouth. And like you were speaking about the power of marketing earlier,
Yes.
that's like totally. For instance, I had to get some eye drops for my eyes, and I said, okay, immediately I need to go to the store and get Visine or get one of these highly marketed. And folks were like, no, not necessarily. It's not necessarily the best one.
Yeah.
Yeah, so marketing is very powerful, but I love what you guys are doing. And thank you so much for taking the time to talk with me
Sure.
today about it. We are pretty much at the end of our talk, and I would love to have you back on to talk a little bit more about some new stuff that you all are
Of
doing at
course.
ClearCost, maybe some other projects that you're working on. Are there any words that you'd like to share with the audience before we close out?
Sure. I know you and I had talked about kind of consumer tools or places that people could go to try and find
Mhm.
this information. So
Mhm.
ClearCost works with, for the most part, large employers and health plans and
Mhm.
healthcare entities, things like that. So
Mhm.
if your employer uses ClearCost, great, go ahead and check it out for sure. But if not, pretty much all the health plans at this point, all the major health plans already have price transparency tools on their website.
Okay.
So if you look up your health plan and price transparency or a cost estimator, you can find it. Sometimes it's a little buried, but you should be able to find it, or you can call them and just ask them to direct you there, or to give you a cost estimate. And they are pretty much required to do it at this point. Some of the smaller health plans don't have it yet, but they will within the next year or two. You can also always look up the cost, the kind of a baseline cost in your area, just on Google. There's lots of tools that help you do that. And that way you have a sense of what the cost is. And so if you go to a provider and you need to get a service, you have an understanding of whether or not what they're quoting you is really high or reasonable. And then in terms of medications, there's this amazing website called goodrx.com. And they provide tons of coupons, information about alternative medicines that you can take, not alternative in terms of like, natural medicines, but just the generic version, advice, all of that. And we use them actually all the time. So another one that I recommend.
Awesome. Great. It sounds like a best practice to have a tool like that, on the payer portal or, payer website. So that's great. Great to hear.
Yeah.
Well, Suji, thank you so much. And
thank you.
I look forward to having you on again in the future.
Sounds great. Thank you so much.
Thank you.
Have a good afternoon.
Thank you to my listeners for tuning in. I hope you enjoyed the talk, and I hope you will take the steps to empower yourselves as consumers and understand your costs and your options so you can make a more informed decision around your care. That is the power of small data in healthcare. To subscribe to the podcast, you can find us on Spotify, iHeartRadio, TuneIn. You can also go to www.eim-inc.com and click on Let's Talk Small Data to learn more about the podcast and Emma. And this brings us to the end of the program. I want to say, have a wonderful day, and remember, unleash the power of your small data. It's your most strategic asset. See you next time. This episode is brought to you by Effective Information Management Systems, specializing in healthcare small data and offering expertise that goes beyond technology. Visit www.eima-inc.com to learn more about Emma and the podcast, Let's Talk Small Data.